Hello everyone, in this video we will be discussing thyroid hormone synthesis. Now in this image we have blood on the rear left side, and in the middle we have the follicular epithelial cell, and on the right side we have the follicular lumen. Now I want to show you guys what this actually looks like in real life. So this is going to be the lumen, and surrounding the lumen we have the follicular epithelial cells. In this image we're going to be focusing on one follicular epithelial cell for simplicity. And the red things that we actually see are going to be the blood vessels. And so this is going to be the site in which the thyroid is going to use in order to communicate with the rest of the body. So we're going to be excreting these thyroid hormones into these blood vessels surrounding the lumen. Now let's go back to our previous image. So number one, we see the transportation of thyroglobulin from the epithelial cell into the lumen. Now, thyroglobulin is going to be a glycoprotein that is going to contain tyrosine, and we're going to use this tyrosine in order to produce the thyroid hormones. Number two, we see a co-transport of iodide and sodium. Now, this co-transport is going to be requiring ATP, so it is ATP dependent. And this is important to know clinically. So, this step is really important to know clinically because, for example, if a patient was exposed to radioactive iodine, then in order to reduce their chance of developing thyroid cancer, we need to give them potassium iodine. Why? Because we want to make sure that this radioactive iodine does not get into the thyroid. And so it is going to do that by using this co-transport. So if we give that patient large amounts of potassium iodine instead, then that is going to reduce their chance of uptaking the radioactive iodine because they're going to have a much higher chance of uptaking the potassium iodine that we gave them because we're giving them in such large amounts that we want to overwhelm this co-transporter so that that patient does not uptake the radioactive iodine instead. Now let's discuss step number three. Now that we have this iodide in the follicular epithelial cell, we're now going to oxidize this for it to become iodine, and we're going to throw it into the follicular lumen. Now this step is going to be catalyzed by tyrosine peroxidase, which is going to be the enzyme that is going to catalyze the next couple reactions that we're going to be discussing. Now this is important to know clinically because when we're treating hyperthyroidism, we give patients propylthiouracil, and propylthiouracil is actually going to inhibit tyrosine peroxidase in these levels. So it is going to inhibit all these reactions. Now, once we oxidized iodide to iodine, the iodine is now going to combine with the tyrosine that is found on the thyroglobulin. And once it does that, it is going to produce MIT and DIT. And this step is called the organification step. And this is also going to be done with the enzyme tyrosine peroxidase. Now, the next step, we have the production of T4 and T3. We are going to be producing the T4 when we combine two DITs together. So the combination of two DITs is going to give us T4. When MIT combines with DIT, it is going to give us T3. And these two reactions are both going to be catalyzed again by tyrosine peroxidase. Now, the reason why we have a higher level of T4 in our body than T3 is because The combination step of two DITs are going to be much faster than an MIT and DIT combining to produce T3. So because that step is faster, we're going to have higher levels of T4 in our body. Now that we have formed this iodinated thyroglobulin, we need to transport this from the lumen into the epithelial cell. And in order to do this step, we need some sort of stimulation coming from the anterior pituitary in the form of TSH. So anterior pituitary is going to release TSH when the body needs thyroid hormones. And once the thyroid gland receives that signal from the anterior pituitary, we can then transport this iodinated thyroglobin from the lumen into the epithelial cell. But until that occurs, the iodinated thyroglobulin is going to be stored in the lumen as colloid. And we will also be able to see this histologically. Now, once we have the iodinated thyroglobulin in the epithelial cell, we can then release the T4 and the T3 that it has into the circulation. And once in the circulation, T4 and T3 are going to then have its effects on tissues. Now we can actually recycle MIT and DIT, and this is going to be a way for the body to conserve energy. And then this process is going to start all over again.